While there is no cure for end-stage renal disease, life-saving treatments do exist. First and foremost, kidney complications can be slowed or prevented by controlling your blood glucose levels and your blood pressure.
Our next step is to try another medication, but we have to be careful that we're not using something that's going to harm your kidneys.
To help, your healthcare provider may prescribe a blood pressure medication known as an angiotensin-converting enzyme inhibitor, typically referred to as an ACE inhibitor. These drugs lower the pressure in the nephrons, the tiny tube-like structures that filter the blood in your kidneys. They also help to relax the tiny blood vessels inside your kidneys, all of which decrease blood pressure within these important organs. Because there's more than one group of medications that decrease blood pressure in your kidneys and protect your overall kidney function, you and your healthcare provider can work together to choose the medicine that's right for you. Sometimes kidney damage progresses beyond the degree for which medications can help. When this happens, additional treatments become necessary. In order to stay alive, you'll need to consider two treatment options, either dialysis therapy or a kidney transplant. A kidney transplant is major surgery that requires hospitalization, and the decision to have one requires a lot of patience and support. Finding a donor kidney that matches your blood and tissue type can take time, sometimes years. And after the transplant, you'll need to take special medicines to prevent rejection of the donated kidney for the rest of your life. The advantage of transplantation is that you'll receive a normally functioning kidney and avoid the need for dialysis. However, if you decide against a kidney transplant, are unable to find a donor kidney, or are not a good candidate for the procedure, kidney dialysis becomes your only other option. Dialysis is a process that artificially cleans the blood of waste products. While it is a life-saving therapy, it isn't without its challenges. In fact, research indicates that people with kidney transplants generally live longer than those who are treated with dialysis. There are two main types of dialysis: hemodialysis and peritoneal dialysis. In hemodialysis, tubes are attached to a vein and an artery, oftentimes in your arm, but sometimes in your chest. Your blood is initially drawn out through a vein, flows through a machine where it is filtered of waste products, and then back into your body through an artery. The process is usually done at a dialysis center, takes about 4 hours, and is typically required about 3 times a week. Although you must remain seated during dialysis, you can read, talk, or watch television during the procedure. Unlike hemodialysis, peritoneal dialysis can be performed at home. With this therapy, a plastic tube is inserted into a surgically implanted catheter in your abdomen, and every day you attach the tube to a plastic bag containing a fluid that absorbs toxins. The fluid drains by gravity into your abdominal cavity, where it slowly absorbs the toxins. After several hours, the fluid is drained back into the bag. The advantage of peritoneal dialysis is that you can perform it at home, work, and even while traveling. This allows you to avoid constant trips to a dialysis clinic. The disadvantage is that it must be done 4 times a day, every day, although it can also be performed at night with the aid of a special machine. Careful control of blood glucose levels through diet, exercise, and medications can prevent many people with diabetes from ever developing end-stage renal disease. However, if you do end up with this condition, it's important that you discuss your options thoroughly with your healthcare team.
I just want to make sure that I'm doing everything I can.
By discussing factors such as your lifestyle, living situation, other health conditions you may have, and your preferences, you and your healthcare provider can come to a decision about a treatment plan that's right for you.